Beautiful people, let's talk about lip fillers and how at least I try to make sure that my patients are very comfortable during the treatment. Main thing is, of course, we all know pain perception is different by everyone in this world. I think in one sense, pain mainly is an anticipation of what may come, and therefore it's not happened yet. And therefore you're just overthinking potentially and worried about something that hasn't happened. So don't look at what others are thinking about, how their experience was, because everyone's journey and experience is extremely unique to them. And so I wouldn't use the words of social media or anyone else about how their perceptions was of their pain and or lip fillers and use it on you, because you're unique and you're very different from everyone else, and yet also the same in many ways. So with that said, the best way, in my opinion, to make sure that patients are comfortable is to use topical medicine on the lips for about 15-20 minutes, which really helps numb up the lips very well. And I've seen variations of how patients react to that. Some patients are really numb and don't really need anything else. And then some of my patients or clients are barely numb after 10, 15, or even 40 minutes of having a topical anesthetic on. So that's why I'm saying that everyone is different in this realm. So I add lidocaine with epinephrine. If you're not allergic to it, you can have that. And it's a lip block where we go in on a couple injections point on the upper and lower lip and make sure that you're completely numb. Pros and cons. Pro is that you won't feel a thing. Literally won't feel a thing. Besides, of course, the initial injections that we have to do, which is really minimal. Con is, you won't feel your lips for a while, and you'll be numb for about an hour and a half to 2 hours after you leave the office with more volume in your lips. And I would say the vast majority of my patients that have had lip filler done with the block or the lidocaine with epinephrine, they will never go back and get it with just topical anesthetic, because they just are so comfortable during the procedure. There's one other benefit, which is really for me, which is when my patients are extremely comfortable and relaxed, it makes my job a lot easier, and I can just make sure that I take my time with them and I make sure that we have the best aesthetic results at the end of the treatment. So I think that's my 2 cents on how to make sure that your clients are extremely comfortable during the procedure. Or if you are looking to get your lips done, see if your provider can give that lip block to you in addition to the topical, the topical anesthetic.